Hi there. My name is Luann Lonergan, and I'll be your registered nurse today. Can you tell me your name?
My name is Lori Hurdle.
Wonderful. Can I see your armband? Good. And what's your birth date?
3/8/19.
Okay, Lori, we're going to just, we're assessing the breast and the axilla today, and I'm going to do some teaching if that's all right.
Okay.
All right, I'm just going to ask a couple of questions. Do you have any history of masses or lumps or anything on your breast tissue?
No.
All right, how about any family history of breast cancer? You
I
do.
have a family
Okay,
history.
do you do some breast self-exam?
Mm-hmm.
So we'll just review that if that's okay.
Okay.
Probably the best time to do that would be about 7 to 10 days after your period. That's when there's least likely that there's lumpiness or fluid on board, so that would be the best. So that's something, so we'll just go over that. How about any medications? Are you on any estrogen replacement therapy or
No.
oral contraceptives?
No.
All right, very good. All right, one of the first things I like to tell people is just to observe in a mirror. So in a mirror, if you could observe your breast tissue, and we're just looking at it, and we're just looking side to side, looking at the shape of the breast, the color, if they're symmetrical side to side, so just kind of taking a peek at that. Looking at the areola, the darkened area, again, just looking for any masses, the color. Sometimes if, I'm looking side to side, if one is bigger than the other, if one has visible veins and the other one doesn't. So that's really what I'm looking at, the skin color, what it looks like. Something that you could see might be something called retraction. So I'm just going to talk a little bit about that to help you to see if there's any retraction or dimpling in front of a mirror. If you want to raise your arms up and kind of look at your breast tissue, that might help it. If you take your hands and push them together, and you would look at your breast tissue to see if there's any dimpling, and then also put your hands on your hips and go forward.
Okay.
Wonderful. So that's what we're really looking at for the breast, the breast and also the skin color of it. Again, the areola, I'm going to just come over to the model and look at that. What I would be looking at for that, for the areola, would be that brown color, and we're looking again for any masses, any color changes, looking also at the nipples, the position of the nipples, if there would be cracking or any bleeding or discharge on there. So we're just absolutely just looking at that at this time. All right, that's what you would be observing. And then one other part that we're going to encourage you to do is checking for the lymph nodes. There's a rich supply of lymph nodes in your axilla around your breast tissue. So I'm going to show you how to do that, and then I'm going to have you do that to yourself. Okay, so what I'm going to do, we're going to make sure that you use about these 3 fingers, the pads of your fingers. So that's what I want you to do in circular motions. And we shouldn't feel anything, or we're trying not to feel anything. So if you feel any hardness or a lump, that's what we're, hopefully we're not finding that, but if you do, that's what you would want to report. So I'm going to just grab your arm here, and what I'm going to do is I'm going to go with this hand, I'm going to go underneath the central lymph nodes, and I'm just palpating in your axilla there. And then I'm going to go it's kind of right underneath the axilla. It's called on the axillary line, the anterior axillary line. Good, and I'm not feeling anything, and I'm just kind of rotating my fingertips, and then I'm going to go here on the posterior axillary line, and I'm just firm pressure and just feeling if I feel anything. And then the last part I'm going to go here is on the humerus. They call this the lateral area, and this is really on your upper arm bone. Beautiful. So you would do that to both arms. So if you want to try that, Lori,
Sure.
if you want to go on your central, beautiful, and then a little bit farther down on the inside of that axillary line, beautiful, that's the anterior axillary. And then if you want to go on the posterior, great, and then on the lateral, that's right up on your bone up there.
So when I do this, I should do this without any clothes on?
Without any clothes on.
Okay.
Very good observation. Very good.
Okay.
All right. Then the last area that we're going to do is we're going to actually perform the breast self-exam itself. And there's several different methods, and the one that I like to teach people, the easier one, is where you are lying down and you put a towel underneath your scapula. So I'm going to do this with the model here. And this seems to flatten out that breast tissue. So if I put the arm up That's good. And then again, I'm going to just, and we would do this on both sides, and you would use your 3 middle fingers on the pads. And we're going to use the vertical way of doing this, and we're going to go down, and we're going to start here at the clavicle and go all the way down, and you're going to go light pressure, medium, and firm. And you're going to just go down in a straight vertical line all the way till you get to the rib. Then you'll move over a little bit. And again, soft, medium, firm, soft, medium, firm, and you're going to just keep going up, and you're going to get every single area of that breast tissue, just till you get to that upper bone, and we're going to go over here. Do you see, Lori, then?
Yes, I do.
All right, and we're feeling for any lumps, masses, tenderness. And so you would do that the entire length. We're going to go across the breast tissue to the breastbone, and then you would go over to the other side. So again, and then the last area you would palpate would be the areola area. And again, for any masses, for any lumps. And then on the nipples, we would just squeeze those nipples and see if there's any discharge again, and we would want to document our findings. And if you did note any lumps, you'd want to note where they were, and if they were soft or firm, any tenderness, and you would want to report that to your healthcare provider.
So if I needed to tell my mom about self-breast exam, she doesn't have her period anymore, so when would she do?
Oh, that's a great question. She would really just have to pick one day of the month. So many times women pick the first day of the month, and they would just do it one day a month. That's a great question.
Any other recommendation? Is there another test that we're supposed to do?
You know, that would be something you'd want to check with your healthcare provider. Many times women have a yearly mammography, and so that would be something that you'd want to check with your healthcare provider also.
Okay.
Wonderful. Any other questions, Lori?
No, thank you.
Alrighty.